All right. Hello, Nick E. Smith, the first Deputy Public Advocate of the City of New York. Welcome to Life Before the Virus.
Hey, it's good to see you again. How are you doing?
I'm doing great. And please tell us, what does the Public Advocate do, and what are some of the things that you've been working on?
Sure. What is the public advocate? So I think some folks may know the public advocate is a citywide elected official, second in line to the mayor's office. And the main function of the office is to act as a watchdog for everyday New Yorkers, and helping to oversee the operations of our city agencies and making sure that they're responsive to everyday residents.
So before the pandemic hit, what were some of the things that you were focused on?
That's a good question. This pandemic has been quite the shift in strategy and tactic. But before the pandemic, lots of things, including police reform, the push for increased affordable housing, and of course, the need to improve our mental health response system. Those were and continue to be big priorities. But I think after the pandemic hit, we've had to shift our lens and approach on some of those tactics. So right now, we're primarily focused on sort of identifying issues that New Yorkers have during the pandemic, whether it's frontline workers or whether it's people of color experiencing a disparate impact in terms of the coronavirus response.
So what are some of the things that you're focused on and seeing out in the field?
And this is a tough time for all of us. I think to start with, we're seeing just a bunch of illnesses and fatalities, unfortunately, across the city, across the state, and across the country. So I think the question for everyone in government, including the public advocate and the team, is one, what can we do to sort of stem the tide, to flatten the curve, to ensure that we slow down the number of positive cases that we have of coronavirus? And secondarily, how can we ensure that we identify and reduce some of the structural inequities that face particularly people of color in our society? So that happens to be, in terms of our office right now, a huge part of our focus.
So what are some of your partners in government or at the agency level that you work with on a daily basis to hit on some of these items?
We can turn on the TV any given day and see issues with lack of equipment or issues with frontline workers being the hardest hit, and people of color being hardest hit. We see issues with transportation. We see issues with social distancing, and sometimes needing to remind folks that it's important to maintain at least 6 feet of distance in between each other so we don't spread the virus. So I think what we're doing with partners is raising those messages and ensuring that we pitch to them, particularly the administration at the mayor level, at the governor level, practical solutions that we.
So when did that report come out that you mentioned?
Good question. It came out last month. In fact, our office spent a few weeks putting it together. We have in the office, as the public advocate, myself, a bunch of staff, and then we have 5 deputy public advocates that are issue area specific. So each of them brought their expertise and the expertise of some of the advocates on the ground in structuring each section. And that's, again, looking backward as to sort of what went wrong. For example, not locking down soon enough, not closing schools soon enough, but also looking forward as to what we should do, after the virus abates, hopefully soon. But it is true that folks really should heed the advice of all of our electeds to stay home and hopefully reduce the spread. But the report is available on our site at advocate.nyc.gov, so folks can take a look at it.
And you talked a little bit about racial inequity and how this virus is affecting Black and Brown communities. Can you speak to a little bit of that and what resources are made available through the Office of the Public Advocate to aid these communities?
So we sent a letter to the administration about 3 or 4 weeks ago requesting data from the city on who is being tested, who is testing positive, and sadly enough, who is not surviving a positive result. And we've seen both in New York City and across the country a pretty big disparity in terms of results. Quite frankly, Black and Latino New Yorkers have been the hardest hit and are sort of the first to respond in terms of employment on the ground. So we often occupy roles like MTA, transit workers, et cetera. The folks who, of course, nurses, healthcare professionals. So a lot of the professionals who are on the front lines. So there's a disparity in terms of those who are sort of on the ground, and a disparity in terms of, unfortunately, those who are testing positive and unfortunately dying. So in terms of solutions, we're pushing the administration to work with our office to solve some of these inequities. So again, and I'll give an example on healthcare. The administration enacted NYC Care in recent times, and that allows folks, regardless of actually your immigration status, to get insurance and go to a city public hospital. Those resources, we got to work together, and we're doing so to publicize. But on healthcare alone, it's important that folks know you got to get covered. You got to get covered, because if you don't, you may have an even harder time taking care of yourself. So we're in a tough time, but that's one example to your earlier question about how we're working with our partners, and secondarily, as an office, uplifting the issues that people are really focusing on during this pandemic.
And what role does the Office of the Public Advocate play in encouraging folks to fill out the census this year?
So this is one of the most important questions you've asked, and I'm glad you brought it to me. We've got to fill out the census. So our job, well, let me just talk about why should we fill out the census. And I think it's super obvious, but we all should be reminded. So the Congress apportions federal dollars based on the populations of each state, and of course of each city. So it's important that as a population, we fill that census out. And we shouldn't worry about immigration status or anything like that. We've really got to have an accurate count of who's living in our homes, so that we know at the federal level, how much money to apportion to our states and our cities. And folks can fill out the census through census.gov. But our role is to really make that clear. And so we've had a census event, a digital census event, and we'll continue to publicize the importance of filling out that document. But again, I encourage everyone watching to fill out that document at census.gov. And again, that's regardless of anyone's immigration status.
Right, because that's not a question on the census.
Exactly, yeah.
Thank you. Thanks for all your work that you do. It sounds like you have your plate full between your twins at home and all this craziness and all the inquiries that come in. So thank you for your service.
That's true, thank you. Very good to see you.